Welcome to my podcast. Today I'm going to talk about another common case that present in the GP practice. So basically, after you introduce yourself, double check the patient date, patient name and date of birth, as we always agreed. The patient might be a lady, teenage, any of those kind of ages, and will say that, doctor, I'm having these bumps and redness in my face, and I don't know what to do about it, and I feel embarrassed. It's affecting my self-esteem. It's impacting on my daily activity, my socialization, and I tried everything I could. I tried OTC, didn't work. I tried the concealer, just clogging my face, and I don't feel happy with that. I just want something that can help with the lesions and the symptoms that I'm experiencing. So you will say the patient, can you tell me more, and how all started, what's those medication you have used so far, and try to understand the patient perspective and how it's impacting him in the daily life. Just try to mention that, because certain patients, it stated that it just can lead them to the depression, some sort of suicidal ideation. So you need to assess all of that. And then going back to the sign and symptom, you need to distinguish between those common skin problems in those kind of ages, which is basically acne and rosacea, and you need to pay attention what could be distinguish factor between both, and what physical symptom that you can see it with your naked eye in order to differentiate between both. So the patient might say, I'm having these bumps and this redness and this stinging and burning sensation in my skin. In that condition, it's mostly will fit with the rosacea, especially if the woman in her mid-age and already past the teenage age. However, for teenage, usually it will be mostly comedones, which is basically white and black heads, and could be with bumps and some scarring, papules, pustules, oily skin, seborrhea. So in that condition, it will fit more with the acne rather than the rosacea. So the main factor that you need to think of is basically the age and the gender. And then you need to remember as well, Afro-Caribbean skin or the dark skin, the symptom can be different. So they might present with some sort of inflammation, and of course redness can be hard to distinguish. However, you might see some pigmentation, also papule, pustule scars, which all need treatment early on in order to prevent further scarring. And after you have checked all of that and you're quite sure what's the diagnosis in front of you, don't forget to pass through the past medical history if there is anything relevant, medication history if the patient is taking anything that could trigger those kind of lesion. Also the food. Early on it was stated that certain food can cause so, and then at certain era it stated no, food has nothing to do with acne or triggers, only glycemic index. And then now back again stating that foods have influence on triggering factor for causing and exaggerating acne. So I need to take history of that, to take note what kind of food I eat and advise accordingly. And then you will ask if there is any family history in the family. It's been stated certain family, they have, if the mother, for instance, had it before, it was severe, haircuts, or might have the same path. So just remember that's one of the things. And then if there is any allergy, for instance, in order to distinguish if it was a one-off episode or it's something that been running for some time. And then after you just examine the patient, you need to look in the face. You need to ask if there is certain patient They use this kind of what they call skin care. They use it excessively, and this will just cause the skin to be more sensitive. So I need to advise to stop that, and it's not needed because it's not dirt. It's just some sort of inflammation in the pilosebaceous tract. So you will, for instance, for the acne, you will start with Ibido, which is a mixture of adapalene and benzyl peroxide. The percent can be between 0.1 to 2.5%. Accordingly, usually it's used at night for 3 to 5 months, and usually the patient will be happy with the outcome. And for this one, the rosacea, you need also to assess at which age it all started, if the symptom is painful, if it's sting, if the skin is very sore. You need to also examine the nose and the eyes because sometimes it affects those areas, and especially in men it can cause rhinophoma, which is basically a large nose at a certain stage. You will need to undergo carbon dioxide laser reshaping of the nose. And you need to check if they have used the basic treatment at the GB practice, which is basically the well-known antibiotic for this sort of thing. And that condition, once you just found that all symptoms and all signs fit with rosacea, so you need to explain the predisposing factor, for instance, the sun, certain beverages, hot drinks, hormonal change, people if they drinking alcohol as well. So all sorts of that thing, and hotness if we are in a hot place as well, and the sun, all of that will trigger rosacea and make it intolerable. And sometimes you see telangiectasia, thin skin, broken skin. So all of that fits basically with the rosacea. So you need to advise about the triggering factor and using sunscreen. The basic treatment can be given is Solantra, which is basically a gel, ivermectin, which used once for at least 1 month, and usually the patient would be happy with the result. So, and then you will, after this 4-month period, you will give them a follow-up to see if they were happy with the result, if treatment has been effective, and also agree with the patient before starting the medication, and see if they are happy to start with this simple way, and then we can take it from there, and always safety net the patient if there is anything that doesn't seem right. Always do need to come back to you. So that's in short just a brief about acne and rosacea and how we can differentiate and distinguish between them, because basically the treatment differs. Thank you.